Hello, everyone, and thank you for joining the Rocky Mountain Tribal Epicenter's monthly Community Health Webinar Series. The Community Health Webinar Series is a free monthly public webinar series. Usually we would go live with live streaming, but we're fixing that as we're smoothing out some technical issues, IT issues. But for today, we're just going to be using Zoom. That with the Rocky Mountain Tribal Epicenter hosting speakers on public health topics impacting tribal communities in Wyoming and Montana. My name is Hillary Presican. My pronouns are she, her, and hers, and I'm calling you on the occupied lands of the Potawatomi people here alongside the lake coastline of Lake Michigan. I am the Tribal Public Health Training Coordinator here at Rocky Mountain Tribal Epicenter, which is RMTech, if you hear that for short, that's our acronym, through the CDC Foundation under the umbrella of the Rocky Mountain Tribal Leaders Council. During this live webinar series, I will be collecting questions from participants in the chat box here in Zoom that you'd like to ask our speakers on this topic. And once the presentation is over, which is roughly about 30 minutes, we will have an additional 30 minutes to do a Q&A. If you would rather ask the questions yourself directly to our panelists or to our speakers, feel free to hold your questions and just wait until the end when it's a Q&A time. While I'm hosting the webinar, my fellow partner in training coordination, Jennifer Hudson-Schaff, will be assisting with the presentation materials, and she'll be my backup just in case if technology decides to act up, and she would be taking over. So before we begin, I just want to go over some quick virtual housekeeping notes. So today's session will be recorded and used for future training purposes. So your participation on or off camera, audio, text, etc. in the chat box indicates your consent to be recorded. Also, again, put yourself on mute with your camera on if possible, and just unmute it at the end of the presentation when we start our Q&A. If you registered for this webinar and are on Zoom with us, please keep your mic on mute and leave it either in the chat room for me to collect live speakers, or you can ask yourself in the presentation. Let me see here. One last thing, if you are unable to stay on the whole time, or you know someone who couldn't make it to this presentation, today, we will be sharing this recording on Rocky Mountain TLC's Facebook page under the videos tab, as well as the YouTube page under the Community Health Webinar Series channel within that YouTube page itself. I will also be sharing my email in a moment in the chat box for anybody that would like to reach out to me directly to learn more about this or have any questions after this training. So we start moving forward. As we start every webinar and training here at RMTech, we would like to start in a good way with a smudging prayer.
Creator, bless me this day to have good thoughts, to see good things in a person, to hear good things from a person, to talk good to a person so that I can walk with others in a good way. Thank you, Creator. Haho.
Thank you so much, Jennifer. Now it is my pleasure to introduce you to our two speakers today, Deborah Jones and Shamira Castellanos Cervantes, to discuss this month's topic on contact tracing, past, present, and future. Ladies, thank you.
Hi, good morning or afternoon, everyone, depending on where you're joining from. My name is, and welcome to our contact tracing webinar. My name is Shamira Castellanos Cervantes. I am a tribal public health educator with Rocky Mountain Tribal Leaders Council from the CDC Foundation. Prior to my role as a tribal public health educator, I was actually hired on by Rocky Mountain Tribal Leaders Council to assist tribes with contact tracing and case investigation. During today's webinar, Deborah and myself will be discussing with you what contact tracing is, what it was used, what the process looks like, what it was used for during the COVID-19 pandemic, how it was used prior to COVID-19, and how it may be used in the future as we move away from COVID-19. During the COVID-19 pandemic, contact tracing, next slide, please. Sorry about that. There we go. During the COVID-19 pandemic, contact tracing was a system used by public health staff to identify, monitor, and support individuals who have been exposed to a patient who has tested positive for COVID-19 and possibly infected themselves. So to give you a brief overview as to what contact tracing is, I wanted to share this video from the World Health Organization. So Jennifer, if you could please play the video. There's no sound.
There's no sound. Just a second. I'm going to unshare and then I'll share again. Just one moment, please. There has to be a very specific button that I have to push in order to share sound.
Well, Jennifer, while Jennifer's figuring that out, which is totally cool, the CDC Foundation does have really great, and the World Health Organization have really great videos like this to check out if you ever want to check out their website. And I can share those links in the chat box momentarily.
COVID-19 continues to spread around the globe. You can help stop COVID-19 by participating in contact tracing. How does contact tracing work? Contact tracing is a system that has been used for decades to stop infectious diseases. A contact is anyone who has had direct physical contact or was within 1 meter for at least 15 minutes with an infected person, even if that person does not have symptoms. This applies to anyone who has had contact from 2 days before a person gets sick until 14 days afterwards, or from the 14 days when an asymptomatic case tested positive. Once you are confirmed as a contact, you will be asked to go into quarantine, which means to separate yourself from others and to monitor your health for any signs of illness. The monitoring ends on the 14th day from your last contact with the person infected with COVID-19. Quarantine can take place in a special facility outside of your home or at home if you can stay separated from family members. Why 14 days of quarantine? It can take from 1 to 14 days from contact with the virus to develop symptoms. During this time, you should stay in quarantine and monitor symptoms and follow instructions given to you if you become symptomatic. Without contact tracing and quarantine, the virus will continue to spread. This leads to more people becoming sick and infecting the most vulnerable. By identifying and limiting contacts of people infected with COVID-19, the virus stops spreading and the community stays safe. To break the chains of transmission, we all need to work together. If you become sick with COVID-19, stay away from others. Follow the recommendations of your medical care provider and share the list of people who you came in close contact with. With your help, we can prevent further spread of the virus and save more people's lives. By acting together, we can break the chains of COVID-19 transmission.
Thank you. Next slide, please. Click one more time. Thank you. Sorry about that. So during the COVID-19 pandemic, contact tracing was key to slowing the spread of COVID-19 and help protect yourself, your family, and your communities. As mentioned in the video, the main goal of contact tracing is to break the chain of transmission by finding everyone an infected person has been in close contact with. Next slide, please. So to give you a better idea as of how the process works, here is a workflow chart provided by the CDC. Before I go into detail into explaining what this workflow chart means, I wanted to clarify two things. So you will hear me mention something about case investigators and contact tracers. So just before I start explaining this, I just want to tell you what the difference between the two is. So a case investigator is actually a public health professional responsible they're the ones responsible for contacting any person who has tested positive for COVID-19. So the case investigator will contact the patient who has tested positive. A tracer, on the other hand, are the ones who will get in contact with the people who have been exposed to someone who has tested positive for COVID-19. So as you can see on this workflow chart, it all starts off with the case investigator. So what the case investigator does is they contact the patient who has tested positive for COVID-19 to inform them of their positive test results. Once they call this patient, they try to gather as much information as they possibly can in regards to who they have been in close contact with since they tested positive for COVID-19. I will explain this a little bit more as we go down the workflow chart. But to start off, it always starts with the case investigator getting in contact with the positive case and trying to gather as much information as they possibly can from them in order for the contact tracing process to work. During this process, they also monitor the patient for any symptoms, ask them whether they need any type of resources as in food, medicine, or if they are going to need water during the time that they're going to need to isolate. So the case investigator provides them with all the information that they're going to need during their isolation period. Once the patient has identified all the close contacts that they have had, the case investigator then forwards that information to the health department or health organizations responsible for keeping track of the contacts and assigning the contact tracers to contact those individuals to let them know of their exposure to someone who has tested positive for COVID-19. So once the contact tracer is assigned the individuals, they're then responsible for getting in contact with them, giving them a phone call, letting them know of their exposure to someone who has tested positive for COVID-19, and providing them with any quarantine guidelines or masking guidelines that they might need depending on their vaccination status. During this time, they also provide the individuals with any type of resources that they might need in terms of food, medicine, or water. So if the patient states or the contact states that they might not have enough resources or enough food or medicine during the time that they're going to need to quarantine, then the contact tracer typically provides them with the type of resources that are available in their community. Once that interview process is complete, the contact tracer tries to monitor the individual's symptoms. So they ask the patient whether they have developed any symptoms, and if they notice that their symptoms are getting worse, then the contact tracer will refer them to a healthcare provider. Now that vaccines and at-home testings are available, it is highly recommended that after exposure to someone who has tested positive for COVID-19, for individuals to at least get an at-home test 5 days after exposure. Something I wanted to bring up is that now that vaccines are available, it is important to keep in mind that for those individuals who are up to date on their vaccines, they might receive different guidelines than those who are not vaccinated. So that is just something to keep in mind. Next slide, please. Oh, one more click. Thank you. So as I mentioned on the previous slide, most contact tracing is conducted through phone interviews with exposed individuals. To make this process a little bit more clear, I decided to create this flyer just to highlight the main points of the process. So as you can see, on step 1, as I mentioned earlier, it always starts with the case investigator. So during this process, the case investigator identifies and notifies the individual who has tested positive for COVID-19 and notifies them of their test results. Once that step is complete, we move on to the interview process. So during the interview process, that is the most important part of it all, just because this is where patients are provided with all the information that they're going to need. And this is where the case investigator collects as much information as they possibly can from the individual. So during this process, the case investigator reassures cases that the call is confidential. All of the information that is collected will remain between the contact tracer and the individual, or case investigator and the individual, and of course the health department. This is very important to keep in mind, just because it's important for the patients to know that whatever information is discussed is staying between you and is not going to be shared with their neighbors, their friends, or their family members. During this process, they also collect information regarding who the case has been in close contact with, what their living arrangements are and who they live with. They review any possible symptoms the case might be experiencing, if any. They also review whether the case has any medical history. Let me see. They also provide the case with any isolation, mask guidelines based on their vaccination status. And we typically try to ask patients if they have enough food, water, medicines for their isolation during the time that they're going to be in their isolation period. Once that process is complete, then we move on to the contact tracers. So this is where the contact tracers locate and notify the individuals that they have been exposed to someone who has tested positive for COVID-19. And we provide them with their quarantine guidelines, quarantine orders, and I'm sorry, the chat kind of distracted me, and any guidelines that they might need during their quarantine period. After that, finally, not yet. Yeah, one more step. And then after that, finally, the final step is the monitoring contacts. During this step, we just get information from the contacts regarding any symptoms that they might be developing, and just ensure that things aren't getting worse in terms of their health. And we provide them with any information of resources that we may have. Next slide, please. And just to give you a better idea as to what the interview process looks like during contact tracing, I have laid out the main points of the main information that is usually gathered during this time. So as I mentioned before, during the interview process, we always start with an introduction. So in my opinion, the introduction is usually the most important part during a contact tracing interview, and during any interview really, because this is really where you build rapport and build trust with the individual that you're talking to. So during this time is where you reassure the individual of any concerns about confidentiality that they might have. You show them that you're there to help them, to support them in any way that you possibly can. And during this time, you also provide them with any type of support that they're going to need during their isolation quarantine period. Other information that we typically gather during these interview process is also information regarding demographics, health information, and disease comprehension, just to see what the patient's background is like in terms of if they may have any medical issues. We also provide them with quarantine recommendation and resources. This is where we create the contact elicitation. And finally, during the conclusion, we typically try to wrap things up and review all the points that we spoke about during the interview process. So all the main points that the patient shared with you, this is where you wrap it up, you reviewed with them, and ask them if they have any questions for you. Next slide, please. Okay, now that I've shared with you what the interview process looks like and the type of information that is shared during that time, I wanted to give you an idea of the type of staff that's usually the ones responsible for conducting these type of interviews. Usually when you receive a phone call from a contact tracer or case investigator, the people on the other side of the line are typically public health professionals who have gone through training for contact tracing and case investigation to be able to provide the patient with the best support that they can possibly have. Some examples of staff conducting the contact tracings include, but are not limited to, disease intervention specialists, public health investigators, public health nurses, epidemiologists, and public health staff trained in contact tracing. Slide, please. And something I wanted to share as well, which I think are the most important skills and knowledges to possess in order to be a contact tracer case investigator, are as follows. I think that in order to conduct these type of phone interviews, especially during a time of such uncertainty and a time where a lot of people are scared because they either know of someone who has lost a family member or a friend, or because they themselves have experienced loss due to this pandemic, it is very important for the people conducting all these interviews to be active listeners, to be problem solvers, to have great interviewing skills, to understand the need for patient confidentiality, to have excellent and tactful interpersonal skills, to have cultural humility and competency, to have ethical and professional conduct, and finally, to understand that everyone is different and has a different story. So those are the main things that I think that people need to keep in mind. And now that I have given you an overview of what contact tracing is, what the interview process looks like, the skills and knowledge that you may need, and the type of staff that have been working during the time of the pandemic and even before then, I will hand it over to Deborah so that she can provide you a little bit more information about the history of contact tracing and discuss a little bit about how contact tracing can be used in the future as we move away from COVID-19.
Thank you, Shamira. Hi, everyone. I'm Deborah Jones. I'm also a tribal public health educator with RMTLC and CDC Foundation. And I started as a contact tracer about 2 years ago. And then I moved into a case investigator role, and now I'm a tribal public health educator. So I'm excited to share some information with you all today. And I decided to start out with a video that details Dr. John Snow and the cholera outbreak. So Jennifer, you can play the video.
In 1854, cholera struck the city of London. Over 600 people died in just a few weeks. People thought that when there were terrible outbreaks of disease, especially cholera, that it was caused by poisonous air. But John Snow, the physician in London, was convinced that cholera in particular was a waterborne disease.
He was an icon of epidemiology. Yeah. He was against the flow of the times. What was very interesting about John Snow was the deductive reasoning. He was very much a scientist, and he believed in measurement. As the father of epidemiology, he got on his feet and walked around and started asking, where are these illnesses occurring? So he could see patterns. Epidemiologists essentially look for patterns of disease and then make a prediction of the causes or origins of the outbreak.
And right here was the Broad Street pump. And it turned out that most of the people who had fallen ill and who were continuing to fall ill had drunk water from this particular pump. John Snow is often credited with ending the 1854 epidemic by removing the handle from the contaminated Broad Street pump. The full story is much more interesting.
Thank you, Jennifer. And we can move to the next slide. So I wanted to share that video with you all just because John Snow, he is considered the father of epidemiology, and his mapping technique that he used to identify the source of the outbreak in London for cholera is considered a precursor to contact tracing, which kind of kicks off the history of contact tracing. And so contact tracing, especially in the US, has been a staple in infectious disease control since the 1920s. It's widely been used for STI outbreaks, especially like syphilis and HIV and other infectious disease outbreaks. And it's hugely contributed to the successful eradication of smallpox. So next slide. And so that brings up another case study example that I wanted to show you all. It's involving Mary Mallon, who is also known as Typhoid Mary. And it kind of contributes to the history of contact tracing. This video is created by Johns Hopkins, and I think it's a really great video to kind of discuss how asymptomatic carriers can be kind of tracked and attributed to an outbreak, as we've seen with COVID-19. So go ahead and play the video, Jennifer.
Important development in the history of public health around contact tracing was the case of Typhoid Mary. And Typhoid Mary was actually an asymptomatic carrier of typhoid. The intervention that was made was to effectively isolate Mary Mallon for very long periods of time in order to make sure that she didn't come into contact with other people and inadvertently give them the disease. Contact tracing basically traces and tracks down people who have been exposed to an individual who already has an infectious disease. It comes to be used during the 19th century for diseases that were known to be transmitted either through the air via droplet transmission or through direct contact with individuals. And it was particularly developed for smallpox. And the reason why that's the case is because there was actually an intervention for smallpox that prevented the disease, and that was vaccination. Vaccination was discovered in the late 18th century. Contact tracing was usually performed by local medical officers or health commissioners or members of their health department. They would visit the household and then they would isolate the patient either within their home or in an isolation hospital, a fever hospital. The basic mechanisms haven't changed very much. I would say there'll be developments in the later 20th century with electronic reporting. They would do it via computer, for example. So the actual reporting itself. And, in terms of managing the contacts, the latest development would be the use of mobile apps. This huge effort for contact tracing is absolutely crucial for public buy-in for the relaxation of social distancing measures and regulations. And I think in future pandemics, knowing how to build that confidence through testing, tracking and tracing is going to be very important.
And just some additional information and background on Mary Mallon's story. So George Soper, he was a doctor and sanitary engineer who worked on the contact tracing and case investigation of the typhoid outbreak that was in New York. And he had a theory that there was someone who was probably asymptomatic that was spreading this disease because it kind of impacted, I think, about 3,000 people total in New York, but once it started impacting wealthy families, that's when it started gaining a little more traction in the media. So he had developed a hypothesis that it was probably someone asymptomatic, and he got into contact with Mary because she was actually a cook to wealthy families on Oyster Bay. So she was making peach ice cream, which is frozen, obviously. So when she was shedding the virus, not the virus, the disease, it was getting into the ice cream, and obviously it's frozen, so it's not going to kill the bacteria. So that's how he kind of was able to connect the dots and kind of did like a mapping technique that Dr. John Snow did. So very interesting story, very interesting case study, especially since it involves someone who is asymptomatic, which we saw a lot during the COVID-19 pandemic. So I wanted to share that with you all. Okay, next slide, Jennifer.
Important development.
And now I'm going to go into some myths and misinformation about contact tracing, especially ones that I know both Shamir and I came into contact when we were doing these interviews. People think that contact tracing is not confidential. They may think that the calls and the scams are to gain their identity. And then also they probably believe that contact tracing is used to identify people who are, exposed, and the government will probably come and take and whisk them away from their homes. All of these are myths. Contact tracing is confidential. It's covered by HIPAA, so we are not able to, divulge information about the contacts to other contacts. We cannot tell who, gave us their information, who the case was. We cannot divulge any of that information, so it's completely confidential. And then the calls are from authorized public health professionals and personnel. And then also contact tracing is not used to remove individuals from their home unless absolutely necessary by supervised quarantine and isolation is required, which was, not really necessarily the case for COVID-19, obviously, unless people are hospitalized. Okay, the next slide. So now we get into the question of, are we scaling back on contact tracing now since COVID-19 is, kind of dwindling down a little bit per se. So the CDC, it no longer recommends universal contact tracing that you've probably been more familiar with during this pandemic. It is still used for COVID-19, but on a more limited basis. So it's now more so heavily focused on congregate settings such as like nursing homes or shelters, places that people are at high risk and in a more condensed setting. And then for cluster outbreaks. So for example, if there was a huge concert or something that took place, and then we saw an exponential amount of cases come from that, then contact tracing will be conducted because that's considered a cluster outbreak. So now the question becomes, where do we go from here? Since contact tracing isn't done on a universal scale, what are we going to do now? And next slide. And so that brings us to the future part of contact tracing. So if you go ahead and click through, I think there's 3 bullet points. Perfect. And so we can use digital technology for contact tracing, such as proximity tracing and exposure notification, which has already been being used during the pandemic. So if you live in a state where that's been approved, there may be some different apps, or even iPhone has notifications now for exposure notification. I think it's in 26 states. So for example, I know that California uses California Notify, which is used when there is someone who is like in a proximity of being exposed to a patient that was diagnosed with contact tracing. So this is used through like Bluetooth or GPS. It's still strictly confidential. You will not know who the person is. You would just know that you were in an area where you were potentially exposed. And then also contact tracing is used in other areas of public health. So as I mentioned before COVID, it was used for, STI outbreaks. So we can still pivot and use contact tracing for STIs, foodborne illnesses, and other infectious disease outbreaks like malaria. We've used it for Ebola. So it's not going away, and it actually isn't something new as we've seen. And you can go ahead and click. And then you can also repurpose your contact tracing staff and use them in other areas. So contact tracers, now that it's not being used universally anymore, you can use it. I mean, you can use those staff members, or, like Shamir and I, we are now health educators. You can absolutely pivot those people to health education, community outreach. An important piece of contact tracing that Shamir mentioned earlier is, you have to provide that education of the illness to individuals, because some people may know what the disease is, but they don't know specific details of it. They don't know how to, mitigate their transmission. And you can also provide them and, link them to other resources. So food, financial resources, get them healthcare if they need it. There's an infinite of possibilities. So that's where we see the future of contact tracing going forward. And of course, if another pandemic happens, hopefully it won't, but the way that things are, there's a possibility that that can happen in the future. So we'll already have this in place where we can, easily mitigate. Oh, I just wasted my water. We can easily mitigate it to be, right on time and have quicker response. Okay. Awesome.
Awesome. Thank you so much. And I love this slide. It just speaks for me. So yeah, so at this time, let me promote and move everybody. Well, I guess we can probably keep you as talking permitted with all the participants. We can just have a group discussion about what was covered. If there's any questions that you may have for Deborah and Shamira on this topic. So feel free to unmute yourself, participants, and ask away.
I'm going to go ahead and stop sharing because, yeah, we're in the question and answer.
Great, thanks. Well, while people are probably still thinking about a couple questions, I could get the ball rolling, so to speak. I know you just covered this, so if so, I can move on to a different question, but is COVID-19 still an important health topic right now?
Yeah, absolutely. It's still important, especially because it's still going on. So we need to keep the momentum going with vaccinations because it's still here and it's not going away per se. So we want, people to go ahead and keep getting vaccinated, keep learning as much as you can about COVID-19. I know that at the beginning, it was all over the place. It was all in the news, guidelines, everything. But now it's kind of veered away from the news so much. But I say that, keep being informed, ask your healthcare professionals any questions that you may have, just like you would with any other, illness. And also, if you feel symptoms, definitely get tested or stay home. That's the most important piece. And I think that you can still get at-home tests sent to your home too. So if you haven't done that, I highly recommend you have those so you can get tested if you do start feeling symptoms or if you were exposed.
And just to add a little bit more on what Deborah was saying is that keep in mind that not everyone is vaccinated too. So the fact that not everyone is vaccinated means that there's still a high risk of COVID-19. The virus is still out there, even though people aren't wearing masks anymore, all the guidelines are being lifted. Just keep in mind that the virus is still out there. There's people who don't have any protection, and there is also people who aren't able to get it. So just be safe. Personally, I say still wear a mask around others because even though you might not show symptoms, you can still get someone else sick. So that was just something I wanted to add to this.
Yeah, I've been seeing like on NPR and other news stations talking about and reminding people, if you can still mask in public, especially with those who may have a disability or a weakened immune system, they're still at higher risk during this pandemic, especially with Omicron and other ones. And Minicron or Omicron, I'm not exactly sure what the official title is for this, the offset of that Omicron virus from COVID. It's still there and it's still impacting a lot of people that just don't, as Shamira put, it's just still impacting them. The pandemic hasn't left. It's still impacting quite a few people. We do have a question from Divya. Are the tribal communities more hesitant than others regarding contact tracing?
Thank you for your question. I don't believe so. I think that there obviously is great hesitancy across the board with contact tracing because it was still an unfamiliar concept to the masses. So of course, if someone's calling you out of the blue with requesting information, you'll have a little bit of hesitancy. But I think that goes back to building a rapport and building that trust when you're on the phone. I know that when I was conducting contact tracing and case investigation to put people's minds at ease, I would say like, hey, you know, you can email me. This is my email. You can send me a quick test email while we're on the phone. And you'll see that my email is from a professional public health organization. You'll see it says like cdcfoundation.org or TLC. And that was usually something that people would be like, oh yeah, I'll send you a quick email really quickly right now while we're on the phone. And after that, it was no problem, you know, conducting the interview. So I think just kind of making people feel a little more confident and comfortable, and make sure that it's not a scam, because, you know, I'm pretty sure everybody gets those calls a million times a day about car warranty and this and that. So you have to be a little bit, you know, cautious. So I don't think there's much hesitancy.
Yeah, you have to remember too, like a contact tracer is not going to ask for your, you know, the street you grew up on, or the name of your first pet, you know, information like that could be seen as questionable. It'll be directly about the health, you know, the public health issue at hand.
Right.
Thank you.
So I'm promoting people to panelists because I feel like that's probably a little bit easier and accessibility wise for people to ask questions themselves. So if you see me trying to promote you to a panelist, that's why. So if you want to accept that, that's awesome. If not, you can totally stay where you're at. But I do remember, I think Deborah or Shamir, I think it was Deborah, you mentioned something about getting a COVID at home test. So a question I've been thinking about is like, say, for example, now that I have an at-home test for COVID, or like a testing kit, who would I reach out to notify that I have COVID when I have minor symptoms? And the contact tracers aren't really in that position anymore. You know what I mean? Like it's, because I know a lot of tribal communities, at least who we've been surveying, reaching out to, they've already pivoted to different directions for contact tracing. So yeah, I'm kind of curious, what would one do?
I think in terms of at least something that personally I've seen with people that I know, friends, family members who have done the at-home testing, the most important thing about doing that, especially if you end up with a positive test result of like at-home testing, I personally trust the PCR testing a little bit more. So, but if you take an at-home test and it comes out positive, there's a very high chance that you actually have COVID-19. So if you get a positive test, I would recommend you to let everyone know, everyone that you've been in close contact with, everyone that you might live with, coworkers, especially if you're going into an office with a lot of other people, let them know. Like send them a text, be like, hey, I tested positive. So I would highly advise you to at least try to get an at-home test to make sure that you don't have COVID.
Yeah.
But sorry, go ahead.
No, I was going to say, and to add on to that, there are some caveats, right, with everything there is. So if you're having minor symptoms, of course, whether you're having minor symptoms or you're asymptomatic, if you get positive tests, like Shamir said, identify your close contacts. And you may need to call your employer because you're going to have to isolate, right? But if you're having minor symptoms, there's not really a necessity for you to report it to like your healthcare provider unless you are having severe symptoms or your symptoms start to get worse. Because at-home testing kits, those aren't really reported to the public health department. They're not counted in the, in the overall COVID-19 count. So if you're having minor symptoms, follow all the guidelines for isolation, identify your close contacts. But if you start to have severe symptoms, identify your healthcare professional. If you have hard to breathe symptoms, shortness of breath, things like that, obviously call 911. However, if you work at a high risk environment, so if you're in a congregate setting, or if that's where you were when you were exposed and you got COVID-19, then you will have to let that facility know as well. So those are some caveats to, being positive from a self-home test.
And something else I wanted to add to my last comment was that the reason why I said that I trust PCR tests more is just because sometimes the at-home testings might not show you a positive result, especially if you don't have enough COVID proteins in your system. It might not be able to record it. So if you're having some symptoms and you're not 100% sure whether you have COVID or not, I would highly recommend, if you're able to, go get a PCR test. That's the only reason why I said that. Just to clarify.
No, thank you so much. A clarification is the name of the game here at the Community Health Webinar Series. So I do appreciate that. Does anybody else in the room? It looks like we have about 6 more minutes before the end of the webinar. And if people want to stay on a couple minutes after, if possible, that's cool if our speakers can. I definitely don't want to not have a question answered just due to time, because I really want to be able to help answer some of these questions. So yeah, any participants have any questions for Shamira or Deborah on this topic? Well, I guess really for clarification purposes, when I was researching this topic and preparing for this webinar with Shamir and Deborah and Jennifer, I came across a term called case interviewing or case interview. What is the difference between contact tracing and case interview? Or is it the same thing?
So Shamir actually touched on this too, but it's not the same thing. So case interview is when you're interviewing a known positive person. So a known person that has COVID-19. And so during that interview, you collect contacts, which are people who were potentially exposed to COVID-19. They could be positive, they could be negative, we don't know, but they were exposed to the illness. So those are considered contacts, and that's when you'll do contact tracing or a contact interview. And so during the contact interview, you're contacting people who were potentially exposed to COVID-19, and you're gathering information to see how they're feeling, if they have symptoms, if they were going to get tested, if they have been tested, and you provide some information for them. And then that's when they'll go into quarantine, which is for contacts. Quarantine is for people who were exposed. Isolation is for cases, people who are positive. They're known to be positive.
Thank you for that clarification. That helped me. So hopefully it helps some of the participants too.
Yeah,
I will ask those questions. I will put myself out there.
It definitely gets confusing, and a lot of people use them interchangeably, but there is a difference. So it's good that that was a question that you asked.
All right, cool. I have one last question, at least on my end, before the end of our session. And after my question, if somebody else from, again, the participant group wants to share, we'll stay over a little bit of time. But, with learning about contact tracing and how interesting this is, how does one become a contact tracer? What kind of background does a person, one need to have or get to go into a position like this?
Oh, you can go ahead
first. I can go first. Okay. Well, personally, I was I got my bachelor's degree in my college's version of public health is called Health and Society, and I got my master's in global health. So I have background in public health. And when I was first hired by the CDC Foundation, they actually hired me as a disease intervention specialist, working for a different group of tribes I was working with the Bemidji tribes. So in Minnesota, Wisconsin, Michigan area. And there I was also conducting contact tracing. And when I got hired on, the CDC Foundation, along with Glitzy, they put me through a lot of trainings for contact tracing and case investigation.
And I will say mine is a little bit of a non-traditional route. So I love to talk about how I became a contact tracer. So I actually I still am in a Master of Public Health program. I graduated in May. But at the time when I started contact tracing, I was hired by the CDC Foundation. I didn't have any experience in contact tracing per se. I was working in tech. So I was at a startup software company here in Atlanta, and I was on their business development / sales representative team. So I had a lot of experience, working on the phones, cold calling people, providing education about the platform software that we were selling. And so a lot of that experience was transferable to contact tracing. And I knew that I wanted to get into public health, and I wanted to work specifically with the COVID-19 pandemic because it was something that, popped up. I was like, oh my gosh, I want to help a lot of people. So I started doing research, and I found out about contact tracing. And I actually found the Johns Hopkins Contact Tracer Coursera course, which it provides you a lot of training for contact tracing, and it will give you a certificate at the end. So that was how I was able to get into contact tracing. I took the course, and my transferable skills really beefed up my experience for them to be able to hire me as a contact tracer. So it's a little bit of a non-traditional route, but it shows you that you don't necessarily have to have a background in contact tracing, as long as you have some transferable skills and you showcase those interpersonal skills like, empathy, you're able to communicate effectively with people. Those are some skills, like some soft skills that they really look for in contact tracers.
Well, that's really great. I think that's awesome. I didn't even know that course existed. If Deborah, if you are game to share the link to that course, I can share that in the post webinar email with all the participants that were here today, because I know I threw a lot of really awesome resources in the chat box for everybody, but that will also be part of the post webinar resource share email that everyone will get. So. Oh, Divya shared, I was in a similar position to Deborah. I became a contact tracer during the pandemic with the Johns Hopkins course. Oh, that's awesome. So yeah, Deborah, if you want to be able to,
yep.
Deborah's already on it. All right, well, I'm sharing it with everybody right here, but as well, I will share it in that email too. So if anybody is curious and are eager to look right now, it's in the chat box. Just sent it out. Well, anybody have any other questions? Anything they want to ask Deborah or Shamira for this webinar before we conclude? All right. Well, I just want to thank everybody again for participating and being here for March's Community Health Webinar Series. You're welcome, Divya. She said this was very informative. Thank you. So yeah, I'm reiterating what Divya just shared. Thank you so much, Shamira and Deborah. You did an amazing job. As always, my partner in virtual crime, Jennifer, thank you for handling the controls of the PowerPoint slides for me. I really appreciate it. And thanks again for everybody for joining. And definitely keep your eyes peeled for probably going to be a Zoom 24 hours after the webinar. It's going to be shared to everyone, the resources, as well as a survey. And we would love to hear your opinion on how everything went. And if there's, and of course, if there's anything that we can do to improve the quality of what we're doing for the webinar series, I'm also sharing it right now in the chat box. It's a Google Doc. It's only a few questions, but again, we would love your input because we can make it better because we want to make it better for you. So your input is always vital for our virtual trainings and webinar series. So with that being said, I wish everybody a wonderful Thursday and the last day of March. I cannot believe how fast this month went. And a great start to April. And please don't hesitate to reach out to me via email or the organization, Rocky Mountain Tribal Leaders Council and RM Tech. We are here to serve our tribal communities in Wyoming and Montana, and we're excited to hear from you. Hopefully we'll see you next month for April's topic, which we're still in the midst of working on. So I cannot confirm it just yet, but I will be sharing promotional flyers and sending out emails to people as soon as we have all that confirmed. So thank you again, everybody. Have a wonderful day, and thanks again. Bye, everyone.